Hello, everyone. Dr. Nikhil Verma here with another edition of Things I Didn't Learn in Med School. On one of my previous videos, I had an inquiry about making a video on the pros and cons of private practice. I feel like I've talked a little bit about this on my previous videos, but I also felt like it's an important topic. There's something that I've been noticing. There is a shift from a lot of physicians that are in hospital systems that are employed physicians in groups or multi-partnered groups, and they're starting to get frustrated with the current system, whether that be what the insurance companies dictate, whether that is what the private equity groups are dictating, whether that be just not getting along with the group in general, but different philosophies of medicine. And more people are wanting to open their private practice, but they don't know where to start. And they don't have enough information. And I think with information, they can at least make a more educated decision on what might be best for them. Now, there's a whole plethora of reasons why people are doing this. And obviously, I don't want to get too much into that. I think you could blame any of those topics that I just commented on, but I don't know if that's very useful for this video. But let's kind of dive right in. I think there are plenty of pros. Again, I want lots and lots and lots of doctors to leave what they're doing and go start their private practice. But it comes with a lot of risks. And with that, we'll start with the cons. So obviously, you need to have financial backing. Does that mean you take a loan out? A loan of $500,000 to $2 million. Depending on how big how big of a practice you want. That could be a significant financial hit for you. Or do you have enough money in a bank account that you're willing to risk? And I think that's one thing everyone needs to consider. A lot of practices aren't even profitable for the first 3 to 5 years. And I'm in my fifth year now. I'm starting to become more profitable every year, which is beneficial. Fourth year in my practice, but going into my fifth year. But yeah, so that's kind of the concept of, you're not going to be profitable off the bat. And your salary as a physician may be nearly zero. So do you have enough money in the bank account to float that time frame? I think that can bring a lot of stress on relationships. You need to have a partner who's absolutely understanding and willing to go on this journey with you, knowing that you might be in financial stress, knowing that you're going to be spending a lot of time at your practice. When you're employed, and I'm just using my friend as an example, he's very, very, very happy waking up every morning, going to do his procedures, see his patients, and then when that last patient is done and his note is signed, he likes to write all his notes before he goes home. He checks out for the day. He gets to go spend time with his kids. He gets to go work on his house. He gets to go to sporting events. He goes to dinner with his wife. And he gets his 4 weeks of vacation plus a year and goes on great vacations with his family. You don't get that luxury when you have your own private practice. Quite frequently, I'm walking into my office before 6 a.m. And granted, I do leave around between 3 and 5, depending on my workload for the day. But that's mainly because I want to be able to get to the gym, get a hour workout in. But by the time I get home, especially at the beginning, I was working from 7 to 10 p.m. as well. That's sometimes patient care stuff, writing notes, doing office medial tasks, but sometimes that's just having business meetings. That's sometimes reading through contracts. Sometimes that's trying to understand how a practice operates, looking at payroll, looking at your profit loss statements, looking at your balance sheets. At the beginning, you don't have the luxury to afford people to do these things for you. And that can be very stressful. So you're working 80, 120 hours a week, and sometimes even on the weekends. You come into the office like Sometimes I have to come in the office and fix things that broke in the office, or take a look at things, or clean up, or downsize, or upgrade different aspects of my office. And that's more time that I'm spending. I don't have staff that does that for me. Each dollar you spend on someone else doing it is more off of your profits. And that can be very painful for some physicians when they're trying to make a physician salary, when you have car loans and home mortgages, and you want to go on vacation yourself. I think vacation is a big one. My first 2 years of my practice, I did not take longer than a 3 to 4 day vacation. And mainly that was because my cousins were getting married. That was about the best vacation I would take. Even on a long weekend, I felt guilty taking that time off. Now, this year, I have a lot more vacations planned. I'm feeling less guilty about it. But the idea is when you're on vacation, very rarely at the beginning is there anyone else making your practice money. There's not enough patient revenue to hire a nurse practitioner to see patients, or another physician to see patients, or use other means to make your practice money, make your practice profitable while you're out of the office. And that's a tough pill to swallow. And it's a big hurdle to get over. That's a mental hurdle you need to get over after a certain point of time, after the first few years. And now I'm just getting to that point where I'm feeling more comfortable to take some time off. Um, you need to have contracts with the insurance companies, and that's very difficult to get by yourself. Quite frequently, these insurance companies will say that they are closed to your panel, or that panel is closed to your type of medicine. And there are ways around it, but the ways around it don't always favor the physician. For example, you could join a local contracting company, and they can work on getting those contracts for you, but that's not guaranteed. Um, there's also something called a contracted network, where a local hospital system may let you join their network, but the rates, they don't do anything for your rates. They don't favor you. They favor the hospital rates. So if you're seeing patients in the hospital, it can be beneficial. You're doing procedures in the hospital, it's beneficial. But if you do everything outside, then your rates aren't necessarily as high as they should be. Renegotiating these contract rates is very, very, very hard. And sometimes insurance companies will just drop you because they say you're not seeing enough patients, or we don't agree on these terms, or whatever reasons they might have. Other things that happen in private practice is on the negative side. Say I do a procedure and I did the prior authorization. There's two problems that can happen. The prior authorization get denied, and then that takes your time as a physician to go review why I got denied, call the company, call the insurance company, do a peer-to-peer, et cetera, et cetera. Or on the other end, say you did the procedure and you felt like everything was fine and the prior auth was good, that insurance company come back and claw back that money, whether it be because of documentation errors or unapproved therapies or what have you. Even if you get the pre-certification, pre-authorization, this can still happen. And then you have to spend money out of your bank account to go repay this. And that can be a little bit disheartening and take a hit on your balance sheets and your profit loss statements for the month. Ordering supplies, are you going to do it? Are you going to have someone else do it? I know what supplies that I need for my visits and for my procedures, but there's every now and then that I haven't written down what supplies I need and I forget. So do I cancel the procedure? Hey, I'm sorry, come back in a week? And this has happened. I've had to ask patients come back, and it's very embarrassing and it's very frustrating for them because they spent the time and money and did that to take off work, and they were anticipating a procedure and we need to reschedule. So that can be a issue that arises. Purchasing, what equipment do you need? Do you need to take loans for that? For interventional pain practice, we have ultrasound machines, we have fluoroscopy machines. These aren't cheap, and you're likely to need to take a loan unless you're going to pay for a cash up front. So that's another thing you need to consider. I'm just trying to think what else. I mean, other cons, and I'll kind of reverse it the other way, is when you're employed by a hospital or a group, they're spending money on marketing and getting you patients and internal referral networks and all that stuff. And sometimes in those situations, you get bonuses, production bonuses. If you hit a certain amount of RVUs, or if you see a certain amount of patients, you can get bonuses for that. That doesn't really exist in the private practice world. Now, you can give yourself a bonus if things get good and you're seeing a bunch of patients and et cetera, but that's not always the case. And what happens if times are bad? Then do you give yourself a pay cut? I've had to do that. I've taken non-salary for a few months to make sure that my employees get paid. That's another thing. HR. Are you going to outsource HR, or are you going to do everything in the house? Are you going to do your own hiring? One thing I've found out in my few years of practice is hiring is very, 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 very difficult. It spends a lot of time to read applications, screen applications, set up interviews that people may or may not show up to. And even through 2 or 3 rounds of interview, they still might not accept the position, and they might find a better offer. And you can't not compete with the big hospital centers and the orthopedic centers in my field with what they pay these individuals. Now, a lot of individuals that want to work with me, they want to leave those bigger things because they see the other systemic problems, but not always willing to take that much of a pay cut. So, or on the other end is the benefits of insurance and 401k matches. That's something that, small private practices need to consider when they're trying to keep their overhead as low as possible. You might be able to offer some of those things at a some rate, but not as big as what these other companies can give. Outside of payroll, insurance for employees is the number 2 biggest cost in a practice, actually any business in America. So that's something to keep in mind. I mentally try to roll that health insurance into that payroll so I can see that number together, because they are linked. They aren't individual numbers. But it's helpful when you can find someone that doesn't necessarily need those benefits. There's a lot of lonely time. You're spending a lot of time reading and trying to understand things and asking questions, and maybe paying for consultants, and maybe paying for outside reviews. And it's tough. It's very tough. And there's been lots of sleepless nights, many more sleepless nights than I would like, especially at the beginning, and stressful nights, and thinking about the patients. And patients, you are the end stop. You don't have a middle ground. A lot of times you can train your MAs or your staff, but you want to keep your overhead low. So quite frequently, patients are going to have direct access to you and ask you a lot of questions. And that's okay if that's what you like to do and you want to be upfront with your patients and be able to talk to them. I get that. But sometimes that can get overwhelming too, especially if there's complications, if there's just generic questions that don't necessarily need your time and effort. That's something you have to weigh. Is that something beneficial for you? Off the top of my head, those are probably the biggest cons. I'm going to go briefly into the pros because I could talk about pros all day. And that might be a video and a conversation in and to itself. But I think it's important. The biggest thing is, at the end of the day, I felt like I wanted to make a bigger impact than I could at one of these hospital centers. And now I only can base it off my training and based off my fellowship training and my residency training. But I saw the difference between private practice world and what it means to be employed. And at least in the private practice world, you can control how many patients you see. Now, that comes at a cost benefit analysis of how much revenue you can make based off patients. You can see the type of patients you want to see. You can accept certain insurances and not accept others. You set your own schedule. Again, I'm better now, but my schedule for the most part, I'm here, around 6:30 to 7 in the morning, and then I usually leave still around 3 to 5, get my workout in, but I'm not doing as much work on the back end at home as I was the first few years. I still am, and I still have a lot of meetings in the afternoons and evening times, but it's not nearly as bad as it was. Um, when you have very successful months and years, you can use that as beneficial for your practice. You can invest more in your practice, or you can give yourself a bonus, or you can say, "Hey, I made a lot of money this past month. I can take a few weeks off and enjoy time with my family or go on vacation." Another big thing is when you're a W 2 employee and getting a paycheck, you're paying a lot of money to taxes. So you might get offered this $500,000 job and get that in a paycheck, but the taxes will eat you up 20, 30, 40, 50%. So at least when you have your structure of your own practice, you can structure it in a certain way where you can make your tax liability less and less. Working with a really good CPA of finding those tax benefits and finding ways to lessen your tax burden, but still use the money that's there. And it's difficult in medical field, but quite frequently, this is when you'll see other business owners buy G wagons or Land Rovers, Range Rovers, and other large vehicles on their business because they can, and it's a business tax deductible um, asset for them. And in the medical practice, what it's great is we can use it for medical equipment, things that we use within our practice. Sometimes paying for our membership, well, definitely paying for our membership dues, paying for our um, conferences. So, quite frequently when you're employed, you have to use your own money for some of these things, or they don't cover all of them. At least in this realm, you can use those as tax deductible write offs. When we say write offs, what you're doing is essentially putting that money against what you've profited for that year. Now it can get way more complex, and people have done this to make separate entities and help fund those other entities. And then you get into things like nonprofits, and these things are way more complex, and I don't understand them. And but working with a good CPA, they hopefully can guide you to that right direction of make sure tax benefits have maximized, not only for your practice, but for yourself as a physician who's going to be a high income earner. Um, Another thing, yeah, I get to help patients the way I want to help them. I like to do a lot of regenerative medicine, and now I am able to have that conversation with them and not squeeze everything into a 12-minute visit, especially in the musculoskeletal world where we don't know if it's coming from the back, the hip, the knee, and we have to do these exams and talk about the patients, how it could be all these different things, and then explain procedures. That small time frame is usually not enough. Um, you don't always get the benefit of having that longer visits with the patients the other way around. Um, the big thing for me was when I was interviewing for other positions, there was a part of me that didn't feel comfortable being told what to do and how to do it, and not be able to explore other options for my patients. And some of those other options might be diet and lifestyle changes, and that's simply it. And if I'm not generating a procedure for a patient based off of some of these other models, then I'm not making them revenue, then I'm not making my profit bonuses, and none of that felt right. I want to be a physician to help people and give them some education and give them some advice, and hopefully they take that advice. But I also have a certain skill set that I'm able to help with procedures. And that was what became most important for me at the end of the day. And that was like a big reason why I started my own private practice. And I believe that's what a lot of people want to do out there. I think that's why people are starting to say, hey, I want to start my own private practice. What are the pros? What are the cons? What are the next steps, et cetera, et cetera? And I don't know. At the end of the day, you're the only person that can make that decision if that's right for you. But for me, I feel like I made the right decision. And I'm just really encouraged to see what kind of growth I'm going to have in 2026 based off the past 6 months of 2025. And I'm also encouraged to see where the landscape of medicine goes. I'm hoping it'll shift back in the favor of private practice physicians. But with the cuts of Medicare and the difficulty of insurance companies, I don't really see that happening in this year. I'm hoping it'll happen in the next few years, but it's definitely something I encourage you to do. And if you want to know more, feel free to reach out to me. I'm happy to give whatever advice I have. I'm not saying I'm the arbitrator of truth. I don't really know everything. I just kind of have my own perspective about things. And I hope I can be a guide for you in any sense, or at least point you in the right direction of who's helped me in the past. And yeah, well, I hope you found this useful. If you do have any more questions or comments, feel free to drop them below and subscribe, like, and share. And yeah, we'll talk to you soon. Take care. Bye.